I'll go to Article 33, which expects the government to provide ways of protecting children from dangerous drugs, now that it's a known fact that prolonged use of contraceptives increases vulnerability to cervical cancer. I think you are the health committee in our parliament. You're aware of how many women are having cervical cancer in Zimbabwe, how many women are failing to have their services removed because they cannot afford it. To cause immorality to our children, we need to prevent immorality, not pregnancy. We cannot have laws that support immorality. We need to deal with the mind that wants to have sex. We need to increase sexual education and awareness programs to young children. Yes, we have a crisis of poverty and young children engaging in sex. We need to deal with the social misconstructs in our society.
The late famous Dr. Oliver Mtukudzi vakataura vachiti tsvaga chikonzero chaita musoro uteme. Mati 22% yevana vari kuita 4 pregnant, 70,000 yevana vari kuita madeaths, vari kuita illegal abortions. Chii chakonzeresa? Imi musave nekondomu, mutishandisa kondomu kuti usaite nhumbu. Chimbotsvagai kuti chaita kuti ndinoda kuita nhumbu chii?
Vabereki, ndichiona mwana we-12 years, ndikuona mwana asati developer in terms of their mental and psychological capacities. Mwana achiri kuda guidance kuneni mubereki. Mwana andichiri kubhadharira zvese. Saka kana tikamuti mwana uyu ngachi decide kuti ari kuda kuita zvepabonde uye aite methods kana kuti aite amwe mapiritsi kana kuti ashandise makondomu. Zvinoreva kuti mwana uyu akutoita zvinhu zvechikuru asati akura. Saka inini semubereki zvinondirwadza nokuda kwekuti ndikapa decision iyoyo ndiri kutouraya generation. Nekuti isusu takazosvikawo patiri nokuda kwekuti vabereki vedu vakanga vachiti aiwa izvi ndezvevakuru, imimi vana zvenyu ndeizvi, chiindai kuchikoro. Saka inini ndiri kuti semubereki no to that petition. Vana ngavave vana, vakuru voita vakuru, mazvita.
To understand kuti where are we coming from as the young people when we say that there should be no age restriction or barrier to the access of the SRHR issues and services. It seems as if the majority is limiting the context of SRHR issue to condoms and sex. SRHR is a package. We have a lot of factors that we put into consideration when we say that maybe someone who's below the age of 18 or 16 should get a consent from the parents to go ahead and access an STI screening. Because of the economic status of our country, some of the parents have migrated to diaspora seeking for greener pastures. Vachisira vana, child-headed families. Then mwana asirwa mwana ane 16 years. Young people are becoming sexually active and indulging into sexual activities at a tender age. Scientifically proven that most of the girls are engaging in sexual activities at 12 because they are sexually active. When the minister comes to the parliament and presents that 1 in 5 of the children in 2017 failed to proceed to secondary because they fell pregnant, where did the pregnant came from if they are not indulging? So it seems as if we are running from the present reality that these kids are indulging. But at the end of the day, what is our position as the young people? If any young person goes to a nearest health facility seeking for an STI screening, they must be provided that service without a consent.
One of these values is that we have a value and a principle to respect our religious and cultural norms. And that's our value as a nation. Who is Zimbabwe? What is a Zimbabwean? We should separate us from others and have our own identity. That's the first point. So as Zimbabwe, our culture, let's for a minute forget about religion. The culture, traditionally, our understanding is a 12-year-old cannot be expected to be indulging in sexual intercourse. A 12-year-old is a grade 7. A grade 7 going to the family clinic without a mother, asking for assistance in getting contraception. That's a grade 7. From there, let's look at our religion. I'm a Christian, we are Christians, but we are also considering other religions in Zimbabwe. I don't expect any, I actually don't know of any other religion besides Christianity which will say yes to this when we look at our values and our principles as a religion. Section 16 of our Constitution is very clear. It says this nation, the state for this nation, has the responsibility to ensure that our culture and our values are respected. It's a responsibility that our state has. Secondly, Section 60, subsection 3, reads as follows. Parents and guardians of minor children have the right to determine in accordance with their beliefs. That's our Constitution, which is the supreme law of the land. In accordance with their beliefs, the moral and religious upbringing of their children. So if this petition becomes law, what then happens is the parent is no longer in control. The beliefs of the parent don't matter anymore. It is the state's laws that now matter. We are in the process right now of ensuring that we align our laws with the Constitution, which Constitution reflects what we agreed on as a nation. As part of alignment, the marriage bill that we have been talking about, you will realize that it is seeking to align the provisions of the Constitution with regards to the age of marriage, the age of legal majority. Our Constitution says it is only at 18 that the right to marry can be exercised by a young person. Now, our Marriages Act as it stands allows a 16-year-old to get married. So in an effort to change that so that it aligns with the Constitution, we have the Marriages Bill, which is saying we have to change that from 16 to 18. That's an effort being made by our parliament. That's an effort that we are making as a nation to align with what we agreed in 2013. So, if we now say, okay,
for 12-year-olds, nekuti zona chikupana kutariswa kuti seva chichanyanya kushamisira pa the 21st generation yabva yanyanya kuda kuita zvinhu zvepabonde. Chinoita ndechekuti it starts at home. There is no parental guidance, and then pane law yakauya kuti vana havasi kurohwa muchikoro. Pakasirculata mavideos akawanda vana vakaita zvavanoda but havasi kurohwa, anditi tadaro futi pane ma-side effects akawanda e-contraception ataurwa zvekuti imagine inini hangu I'm 22, right? Ndona kamunin'ina kangu kane 12 years ezvinezvi kane access to contraception but ndakakurira ndichinzi zvonichi ndezvemubedroom ndezvanamama hazviite kana zvisingaite hazviite because vana ava vakada lacking guidance. Takakura tichioneswa mavideo ema-STIs kuti mwana azive ezvinezvi vana vari kuita zvakawanda. I remember maverenga nezve abortion again on the petition. It starts from kuregerera mwana achiita because contraception mwana atora condom but raputika aita nhumwa. It's like tiri kuvapa mvumiro kuti vaenderere mberi nekuita nekurara vese vachiita zvavanoda vobva vaita abortion. Totanga kuti unwanted pregnancies, high death threats, vana vari kufa during abortion. So I'm saying no to contraception. Let's find other solutions. Ngatipiwe chikafu vana kwete makondom. Nekuti vanaka tiri kunyengereka kozi tine nzara kunze uku. That's what's happening. Thank you.
Aibva inini ndiri kuti it's a no. Let's not take the right of children to be children. I personally think this consent to 12 years of age is rather deceptive strategy which would destroy the lives and future of children under the age of 18 years. I think let me talk speaking Shona. Munyatsondinzwa pandikuda kutaura. Inini ndiri pandiri panapa. Ndine mwana 1. Ari kutena 8 years in December. I've been using my periods for 5 years. Ndinotodawo kuita vana vakawanda. Asi zvakuramba pamusaka pemaperiods. Mari ndinayo. I've been to different gynas. Vese vakutongotaura kuti let's wait for God's time because my periods anyanyisa mudumbu mako andakakabira a family planning. Saka isusu kana takuti mwana ane 12 years atange kukabira maperiods. Tikuda kuti asvike papi. 1 tatomudamaja. Mwana uyu asati ane immune system yakasimba, whatever reproductive system yake. Akatanga kunwa maperiods at 12 years. Whether akunwa ari kuita nekondom. But paanosvika 20 years, 18 years consent yedu yemuZimbabwe kuti mwana akugona kunoroorwa. Anonoroorwa akadzoswa. Atadza kunozvara. Aditi. Number 2, veduwe. Pambopinda chinhu chemurume apagone kubvisika. Achizorambe kupinda zvakare. Saka inini mai vake kana ndisikagone kugara ndisina bonde. Ko iye akarirayira ka1 tato 50-50 kamumba. Iye achikuda achinoita, ini ndichikuda ndichinoitwa nababa vake. Ndichagona kumutsudza here. Saka inini saamai chaibva, amai vane chido nemwana wavo, nevana vemuZimbabwe. Nekuti kana ndisina mwana musikana, ndine mukomana. Mwana musikana wamai vepa next door. Mwana wangu, zviri kundirwadza kuti handingati makondomu ngaanoiswa pachikoro, makondomu ngaanotorwa pahospital. Inini ndichibuda muchipatara mwana wangu achipinda muchipatara kunotora contraceptive. It's a total no. I hope and think I'm glad kuti mese makagara kumberi uku ndimi commit. Zvatiri kutaura muri kukepucha mune makombiyuta mumusoro menyu because you are not writing anything. Please zvibatei mukudzidzisa.
For these and other stories, visit our website www.263chat.com. Follow us on Twitter @263chat and like our Facebook page 263chat.